It's good afternoon, everyone, then. So welcome to our Lunch and Learn on the Director of Public Health annual report for 2024-25, which is specifically around the topic of how we can measure well-being in Birmingham, and kind of look at it through a different lens as well. My name is Alex Quarry-Jones. I'm a Senior Programme Officer in the Governance team in Public Health here. And I will also be presenting today alongside Aidan Hall. I'll let them just do a quick introduction.
Hi everyone, thanks for joining. Good afternoon. Aidan Hall and I work in the governance team here in Public Health at Birmingham City Council.
Thank you. So if you could just go to the next slide then, please. So just some very, very brief housekeeping for the session today. So if you could just all remain muted for the presentation, that would just help us. But we will be doing questions at the end, and then obviously please feel free to unmute yourself to ask them. If you do have any questions during the session, then please do use the chat function. We're also going to try a slight hybrid of some interactive functions using MS Forms. So, and there'll be a QR code available and a link you can copy, so you can kind of use whichever device you're working on, or potentially your phone if you've got it as well. But also we may be asking people just to add comments into the chat throughout the session as well. So please do feel free to do that as well. And then finally, just to add that this session will be, or is being recorded, and it will be uploaded to our Healthy Brum YouTube channel, so that it will add to the library of other Lunch and Learns, which you can find if you were to search them. Next slide, please. So just briefly today, then, what we're going to be talking you through is a bit of background on what a Director of Public Health annual report actually is. Some may be aware, some may not. So just useful to kind of establish that. Then we'll be looking at the introduction to this particular year's annual report, so the topic, and exploring some of that a bit more. Similarly, we're then going to look at the kind of content of the report through the emerging themes and our kind of measures that we have identified and developed. Finally, we'll be looking at those emerging opportunities which sort of stem from the report and inform what future action could be. And then I was just going to include a little bit on how the report is being designed, just because that's a good thing to showcase. And we should have some time at the end for any kind of questions or queries from those on the joining the session today. So next slide. Yes. So it's very basic. Any Director of Public Health in England has got a statutory duty to complete an annual report, which ultimately needs to in some way discuss or explore the state of health within their communities. Many directors of public health and many public health teams choose to use this to look at more unconventional topics, or those that are not necessarily always covered within different teams' responsibilities. Now, what we've got here is just a selection of some of the previous ones that, as a public health team, we've developed, and under the authority and control of the Director of Public Health. These are the ones that we've kind of produced previously. So last year's one, From Numbers to Narrative, was looking at the all of the data that we had available from the 2021 census, and exploring what the health and wellbeing implications may be for demographic change in Birmingham. As you can see there, we've covered a number of other topics, such as adults with complex lives, and it will be no surprise to see that we did do one on the impact of COVID-19 as well. But now we're going to move on to talking about this year's annual report, and I will be handing over to Aidan.
Thanks, Alex. I think one of the things just to point out to people on the call is we aren't the DPH, the Director of Public Health. So we're the team that support the writing of the report. And really today is about engaging with people as we are developing the report. Often we bring, a finalized version of these types of documents and reports and ways of disseminating the information. But actually, as we've been going through this one, we've realized the importance of talking to people about what they think this topic means to them in the different areas. So this is really just to engage with people on the call, and we're doing this throughout, the next kind of weeks and then over the next month. So yeah, as I said, just going to go through some of our emerging thinking for the current report and some of the areas that we've actually explored. So as Alex said, he talked through some of the different reports that we've had, and they've all had a different purpose. So the focus of this year's report is well-being, and specifically how we might measure well-being at a local level. And we've been continuing to reflect on whether we as a system, a local system in Birmingham, really understand what we mean when we talk about well-being, and particularly the measurement of it. One of the things we have chosen to do throughout writing and developing this report, and through some of the research, is actually not to just develop another index or another framework of well-being. So what we're going to do is talk about some of the ones that already exist, and talk about some of the things we can do to measure well-being sort of on a practical level. But we aren't actually proposing a new index. We're going to use some of the ones that we found throughout our research. So before we sort of get into it, Alex mentioned, bear with us on the interactive nature of some of this. There's not too much, but we really thought it'd be quite interesting to get from the group, before we dive into how we've looked at well-being, if people on the call could actually do that. So you should be able to scan that QR code, which hopefully should work. But what we're looking for here is just, in a few words or one word, how would you define well-being? And you can look at this from your individual perspective, a community perspective, but then also, if you really want to, you can think about, well-being of Birmingham as a whole. Like, how would you actually define that? And I believe we might post it in the chat as well, the link, if that's easier. But yeah, hopefully those should come through. Also post in the chat as well if there's anything that you want to add. But yeah, just sort of looking for, one or two words or a few words, what well-being actually means to you. I think we had a time limit on this, so yeah, no pressure. Is it working? Okay, okay, holistically. Okay, I'll go now. Good health, physical, mental, social. Yeah. Yeah. Let's wait for a few more. Happiness, health. Yeah, happiness came through a lot in some of the research that we've done as sort of a fundamental aspect of this hierarchy of needs. Yeah. Good mental health, place in society. So definitely sort of going beyond the individual in some of these responses. I'll just wait for two more maybe, or a couple more. See if we can actually get a word cloud. Don't think we've had enough for a word cloud. No, these are really useful responses. And yeah, if you're having issues on getting on, please post in the chat as well if there's anything that you want to add. Connected, yeah, really key one. So I'll move on unless there's anything anyone else wants to add, just to give us a sense of where people are at. So I suppose sort of linked to that, some really key themes coming through there in terms of societal, measurement or understanding of well-being, happiness, connectivity, like having that place in society and purpose. Not too much in terms of hope, but those sort of themes that have really come out. So in terms of why we've actually focused on well-being and what we actually mean by well-being, and we work in public health, and this is the Director of Public Health report, And one of the reasons why this topic was chosen is because sometimes we feel like well-being is not just overlooked, but actually misunderstood, sort of misused in certain contexts as well. Um, so what do we actually mean by well-being? Well, people might be aware of the World Health Organization definition of health from the 20th century. And there they actually refer to health as a state of well-being. And linked to some of the comments on the previous slide, it is that physical, mental, and social well-being as well. But again, they didn't really define what they meant by well-being when they made that definition of health as well. And so they brought out this second definition. So this is again from the World Health Organization, where really they talk about sort of that positive state and this going beyond individuals, but on a societal level as well. And again, looking at sort of social, mental, physical, but then also economic and environmental conditions as well. And this definition at the bottom is really what we've used to guide our research and guide our report. And again, that's what we try to look at is beyond the well-being of an individual in Birmingham. How can we start to think about Birmingham as a collective? So in communities, in a city as a whole, how would you measure the progress we are making? How would you measure the well-being of Birmingham? So how do you do that? Well, there's actually lots of ways, and this is just to demonstrate the number of different frameworks that actually relate to well-being and what we've used to inform our report. So there's some great examples in Canada. Really encourage people to go and look at this. And this is sort of talking about that well-being aspect of a whole place rather than just an individual as well. They're all really useful. So people will recognize the top right, in terms of the organization, which was What Works Wellbeing, which was really important organization in the last decade. The bottom left is the UK measures of national wellbeing, which is from the Office for National Statistics, which are a really useful way of looking at national wellbeing and have really informed our report across those 10 dimensions. And really, as you can see in some of these, it's everything right from some of the things that came through in the what you think wellbeing is in terms of that social aspect, right the way through to governance and democracy and how we feel we are able to influence things in our society as well. So sort of moving on, it's worth mentioning what are called the ONS4, so the Office for National Statistics, which are particularly useful and relevant here. And they measure life satisfaction, feelings that are done in life are worthwhile, happiness and feelings of anxious as well, not sort of diagnosed anxiety, but whether someone feels anxious. And they've actually, interestingly, recently added 2 more measures to the UK dashboard, which is Hope for the Future and Fair Treatment as well, which is sort of quite interesting, we think. So these are the types of things that we've used as a starting point for wellbeing in Birmingham, but sort of just influence how we developed the report as well. So, and these are from the National Annual Population Survey, so we can get Birmingham data for this. There are limitations to this data, which we can come on to, but we can look at those personal wellbeing measures and how they've changed in Birmingham. And as you can see, often they do follow a sort of national picture, although there are definitely some differences. And obviously this is just a sample, so this is an estimate of the true value for Birmingham. But if we take a look at this data, you can see in the latest year that we have for Birmingham, which is now 2023, almost a quarter of people reported sort of a high anxiety score. So this is a score based on 0 to 10, and I believe a high one is 6 to 10. So a quarter of people is quite a lot. 1 in 23 reported low levels of feelings that things they do in life are worthwhile, which is quite a lot of people. It's 1 in 23, but it's still quite a lot of people over the course of Birmingham. You know, if you are to estimate that is the value. 1 in 12 reported a low happiness score. And 1 in 20 reported low satisfaction with their lives. And as I said, these are similar to the national average, although you can see definitely some had a bigger impact during the pandemic. So the red line there is sort of disproportionately affected people in Birmingham potentially. And these are, as I said, there are limitations with this data. And they are subjective measures as well. So these have been obtained by literally in a survey asking people, currently right now score these from 0 to 10 essentially. And one of the things we've looked at in the course of developing this report and doing this work is, so going beyond these personal well-being measures, what are the factors that significantly influence personal well-being? So what are the things that if you shift, they can impact some of these scores? And that's what we've really used to drive some of our work. So moving on to what we've actually done then. So based on all these existing frameworks, some of the ones I've talked about earlier, some of the desktop research we've done, some of the engagement that we've done, we've looked at consultations that we've done, public health work across the wider council as well. We've explored wellbeing through these 5 areas. So social, health, so that's physical and mental health, economic and environmental, and civic as well. And we've really explored and considered how we might measure and define each one of these. And Alex is going to go onto this a bit later in the presentation. And effectively, then how we would measure our progress against trying to improve these. And where we do have the ways of measuring, for example, social well-being, we've done a bit of an assessment. Okay, how is Birmingham doing then? Against social well-being, against economic well-being. How are we really doing? And we think that these 5 areas are really influencing and driving those personal well-being measures as well. So almost like a wider determinants of well-being that we've sort of used in the report. And this works both ways as well. So if someone has that higher life satisfaction, this is going to have a positive impact, or likely to have a positive impact on their relationships, on their employment, on their ability to engage with civic activities and civic life. Equally, if you've got sort of high unemployment levels, or if a particular individual is unemployed, that's going to have an impact on life satisfaction, happiness, and hope for the future as well, and some of those other personal well-being measures as well. So I'm now going to hand over to Alex, who's going to talk through specifically some of the themes, some of the definitions, and some of the measures as well.
Thanks, Aidan. So yeah, I'll go through kind of all 5 domains that we've identified, and there's specific measures that we're looking at as well, but I won't kind of dwell on them for too long. But if we go to the next slide, so that first domain we're talking about is social well-being. Now you can see on there both the kind of definition, which has come from the evidence review that we've done, and also exploring how some of those previous frameworks have also defined it. And then what you've got in that table are the kind of the broad themes that we've identified, and then within that, how you could, particular measures that you could use to understand how that theme influences well-being. And then what you'll see also there is the availability of that actual data relating to that measure, both on a kind of national level. I would say I think all of these, if not all of these, are going to be available nationally. Then for a kind of Birmingham figure, so like those previous figures that we saw for the personal well-being scores, that's just available just as a sort of block figure for the entirety of anyone who lives in the within the local authority. But what we're really also trying to explore, and it may be a kind of follow-on activity from this whole report, is how much we can find available data or identify available data that's available at a sub-Birmingham level. So that might be on constituencies, that might be localities, which are still slightly bigger, or even down to wards or neighbourhoods, if that is available and tangible for us. And really that's important, because one of the greater things that comes from measuring well-being is also understanding where there are going to be significant inequalities across the city. And obviously we're dealing with a population of 1.14 million people. One of the kind of goals of this whole exploration in this report was to understand better how just a solid single figure for the entire population really isn't kind of suitable, and doesn't mean as much as if we've got richer, more granular data. So in terms of social well-being, as you can see there, that's in particular, I think the thing to pull out of the definition is going to be the quantity and quality of relationships. And I know that someone put around connection as well when we on the word cloud. And obviously that is a key element of this as well. But I would really emphasize this particular domain is focused around personal relationships or those within our kind of our closest circle of friends, family, acquaintances. But also, as I say, it still needs to cover some of those aspects. So you can see there, for example, one of the particular measures we're thinking of, which may not immediately kind of spring to mind, is around engagement with arts and culture, as that may be a way that people do kind of express themselves and facilitate those relationships. If we go to the next slide, then you'll see here we've made a start on trying to kind of capture some of the data and visualize it. At the moment, all we've got is, as I say, that kind of Birmingham figure to compare to England, but it's very much something that we've been exploring, and we will go into more detail in the report itself about where there is availability to look at things on a sub-city level, and we'll come on to the opportunities where we think that may be. But the big thing to emphasize is that really what we're looking for is a starting point that then allows us to suggest or even kind of recommend that we should measure more granular data when it comes to well-being. And if we just go to the next slide, then this is hopefully going to sort of work. Apologies that this is a bit of an odd way of doing interactive content, but if you get an opportunity in the chat, could you just look at those measures and sort of those themes as well, but maybe more specifically the measures themselves, and just say out of those 6, which one you think would be the most important to be able to measure as an influencer of well-being for this particular domain. And then also, if you think if we've missed anything that kind of fits within those broad themes, then do let us know as well. So just feel free to kind of drop those in. I'll leave that on there for a little bit, just so you can see. You can appreciate that obviously this is where if we had some better ability with some of the interactive elements of this, it may have been more kind of cohesive. But hopefully this still works for those, and people kind of understand and appreciate what we have tried to present as our measures. And just to also reiterate what Adrian was saying, we aren't trying to reinvent the wheel with these measures. As you can see, there's already a lot of work that's been done internationally, nationally, regionally, almost on a local level as well in some instances. So what we're trying to do is very much build on that and suggest where these things would work best for a local context, for a city context as well. That different local authorities have obviously got different challenges. So it's interesting to consider as a city what that would mean. I can see a few comments coming in, so thanks very much for that. I'll give everyone just another few seconds. I appreciate you having to type. Brilliant. Okay. Thank you very much for all those who contribute. We're going to be compiling kind of all of these, and they'll be very useful for our kind of feedback and in terms of like further developing this report. If we go to the next slide, then thank you. So as I'll probably go through these fairly quickly. Apologies that there's not going to probably give everyone an opportunity to be able to contribute in terms of their comments. The next domain that we're looking at, physical and mental well-being. So we have thought to sort of combine the two, as there is such an interlinking between them, but ultimately be explicit that they are separate. And in particular, you can see those measures. Now, I'm sure many people on the call would say that there are a vast number more measures that you could include around this. And you could, also try to get more granular measures as well within particular populations. What we try to do with this is kind of get as high level as we can, but we do recognize that you could have 50 measures if you really wanted within this. So we're trying to sort of cover off what we consider to be the biggest influences as well. And if we go to the next slide, you can see here again we've got some kind of the available data. Some of this we haven't been able to kind of present it and visualize it here, but some of this is a bit available on a more granular level. But you can see again where we rank when we sort of compare ourselves to England. Although we're not setting out to try and create a score or develop a particular index. which you may have seen on some of those kind of previous ones. What we're sort of doing is suggesting and exploring the more kind of conceptual side of, would these actually be applicable? Would these be viable to look at in Birmingham? And ultimately, what can we explore at that sub-city level as well?
Showing this thing.
So if we just, again, apologies that this is probably probably going to go quite quickly, but if people could just look at the measures and just sort of, again, as similar to the other one, you may notice there might be a bit of a repetition here. Just if you could just add in which one you think is the most important, and if you think there's anything major that we may have omitted that could be a better measure or kind of included as well. But I can see that lots of people were already contributing in the chat, so that's very useful. Thank you very much for that as well. If we go to the next slide. So economic well-being is quite an interesting one, because many of the kind of decisions or inspirations for measuring well-being were spurred from the idea that purely measuring economic activity and economic impacts within a population was not suitable enough as a proxy for well-being. So that's very much the genesis of the Canadian Index of Wellbeing, that they were saying that GDP, if you take that as a kind of high-level measure, was not ultimately equal to the well-being of the population, even though that's how it kind of conventionally had been thought as well, that if you were increasing a country's, again, it was on a national level, if you were increasing a country's GDP, you were by virtue of that increasing well-being because living standards were rising. But that failed to recognize that, in particular, after the 2008 financial crash, that GDP rates eventually started to kind of increase again, but measures of well-being, or some of these kind of measures associated with them, actually did not rise at a commensurate level. And so there must have been a reason behind that, and there's a need to then explore why that would be the case. That was, as I say, the kind of rationale behind that. And I think you can kind of see that in a number of different well-being frameworks as well. So with that in mind, on economic well-being, what we've tried to do is to be, as I say, quite a bit more comprehensive. So we're not just sort of looking at economic output. We are considering some of those interactions that may be more direct influences on well-being. So that bottom one, obviously, the indices of multiple deprivation, does take into account many different factors, and most importantly is very available at a granular level. So it's very useful for lots of purposes in understanding different areas and different populations. Yeah, next slide then, please, Aidan. So you can see here, these are, again, some of the measures that we're looking at and some of the available data. I want to draw attention to the figure on the left-hand side, which is the employment deprivation domain, because there's a lot happening there. But again, particularly on that kind of sub-city level, it's important to sort of pull out what that's actually displaying for us. So that domain in of itself is a way of measuring the proportion of the working age population that is involuntarily excluded from the labour market. So people who would like to work but are unable to do so because of unemployment, sickness, disability, or caring responsibilities. So another way that you could kind of define that, and as is done by the Office of National Statistics, is economic inactivity. So it's not just unemployment. It's much more kind of comprehensive. And in particular, that figure there obviously provides it as a kind of heat map, and you can see how it correlates with the indices of multiple deprivation as well. And you can see also from that particular figure, it really is very granular. So that's probably even more than a ward level. You're probably looking at kind of neighborhood level for that as well. So next slide, please. So I know that we're going through these fairly quickly, and I'm sure that's probably not necessarily giving everyone an opportunity um, to be able to kind of add these in as we go along. But if people could, again, just very quickly reflect on the measures that we've got here and add into the chat which one of those you think is most important. And then again, if there is anything that we might have missed as well. I think we came up briefly on one of the other figures that we have within this domain, but just for those that aren't aware, NEAT is, again, another kind of more comprehensive measure. So it's not in education, employment, or training. And so it's just sort of a way of being able to capture what those, particularly in that age cohort of 16 to 24, are being able to work on. Excellent. Okay, and then we're going to go to the final. No, we're not. We're going to the second to last domain. Apologies for that. I think this may be getting a little bit repetitive now, but hopefully you're all being able to get the gist. What we've got in particular for environmental is both kind of those more formal measures, so air quality and access to green spaces, but also some that are kind of more attitudes. So, for example, the measure around the pro-environment lifestyle, which has got kind of different definitions, and you can kind of draw on which definition you would like, depending on kind of who is asking that question. But then there are some other more kind of objective measures, quality of living environment, which is linked to indices of deprivation, is very useful for being able to assess essentially how access to different green, blue spaces links to where people actually reside and work. Next slide then, please, Aidan. So similar to before, you can see that we've got another very comprehensive figure on the left-hand side. That's the blue-green space domain. So that basically presents to you where there is access to green space and blue space. In this instance, blue space is sort of water, so canals, lakes, rivers. And as you can sort of see, again, the distribution at quite a granular level across the whole of the city. So it's very useful to then use that and correlate that to certain different areas as well. Like all of this data, as I say, is kind of, we're presenting what we have got to establish where we are, but we aren't necessarily fussed with it all being exactly aligned in the same way and available at exactly the same level, because ultimately we accept that there are going to be discrepancies with what is measured, how it's measured, where it's measured as well. In an ideal world, we could measure everything at a very granular level, but we recognize that's not practical. Next slide then, please. I will leave this up again for a few seconds just for those to be able to have a quick look at these particular measures within the environmental well-being domain, and where there may be any others that people would like to suggest. But I would like to just again apologize for sort of the speed at which we're going through some of these. Do also please feel free to add any kind of general questions that are coming up from anything we've discussed so far, and we'll try to get through to those when we get to the question and answer element of the session. Right, if we go to the next slide then, please. This is our final kind of domain that we're going to be talking about, civic well-being. A good way to kind of conceptualize this is that if social well-being is very much about our personal relationships and those in our kind of closest circle, then civic is about how we have relationships in a society and as a civic body. I don't necessarily think that's a sort of an entity that people would see in a formal sense, but it is the fact that we all live, work, study in Birmingham as the city, and therefore we all have relations in that way. And this is the kind of the binding element of that is our civic well-being. So you can see that there in there you've again got a sort of series of subjective and objective measures, some of which is available at that sub-city level. So for example, voter turnout, but many of the others not so much, and some not even really on a kind of Birmingham level at a whole anyway, which means that it's something for us to kind of explore further. But if we take, for example, that measure around trust in local government, just because that's not necessarily available as an explicit measure, that doesn't necessarily mean we've discounted it. We still believe that there's a strong rationale for including that, and suggesting that there are ways that it could be measured in future. If we go to the next slide, so you can see here just kind of a couple of the baseline figures for where we are with that. In particular, there we on the right hand side, we've got the turnout map for the last set of local elections, which were a few years ago. And as you can see, there's sort of quite an interesting difference between the different kind of turnout rates across different wards in Birmingham. And then on the left hand side there, we've got the kind of rate of those who volunteer at least once in the last month, compared to England. We've got England as a comparator for a lot of these, but in some ways that's useful, but in other ways not so much, because obviously as a kind of the populations are not synonymous. So that means that there are some elements that we want to draw on differently, but very much in many other ways we kind of benchmark against where we are nationally. If the data was available, it would also make sense to probably look at comparing to more similar areas across the country, such as other core cities that maybe have a similar population. And then next slide, please. So yeah, final one, you will be pleased to know. This is just how, again, if there are any of these measures that you think which one the most important would be as a driver and influencer of well-being, and then also if there's anything we may have missed that kind of fits within those broad themes on the left-hand side there. Just give everyone a few seconds just to be able to read these. Right. Thank you for kind of bearing with us with the semi-interactive element of this. I believe I'm now handing back over to Aidan for a discussion on where we've kind of identified the emerging opportunities within the report.
Great, thanks, Alex. And yeah, thanks for everyone's comments in the chat. I'm sort of on one screen, so I was trying to sort of read through them. And maybe we could pick up some of the questions at the end if anyone wants to come in. Some really, really good stuff in there though, so thank you. And some key themes coming like throughout each of those domains, Alex, which is really interesting, and some really good comments as well. So yeah, we just this aspect is really about or this part of the presentation is, as we are developing the report, what are the opportunities that are coming out for us to consider? So a lot of them have been sort of talked about today in terms of stuff in the chat and already some of the things that Alex has talked about. But yeah, I'm just going to sort of go through these quite briefly. So the first one is really around the measurement aspect of wellbeing, and obviously this is a key part of the report. But some of the things that are really coming up quite strongly is our need to measure this at a sub-city level. So when we have sort of values for Birmingham based on national surveys, it's very difficult then to think about where we can target sort of work or target interventions. So we need to think about that sub-city action, so localities or even sort of further in terms of more granular data, but not just adding another survey, but thinking about how we can embed them in existing surveys or in existing work, or where we are engaging with particular communities or users of services and things like that, or citizens more generally. How can we think about we can sort of gather this information? So whether that's in routine surveys or local indexes, or where we are using things like WenWeb, so the validated questionnaire on mental health and well-being, using that in more interventions, in more services, not just across the council, but across many of our opportunities as well. And then I suppose one thing that has come out through the report is the importance of that subjective data, and that's come through some of the comments in the chat today, actually. So not just quantitative, objective data, but also some of those experiences as well. So some of that qualitative work that we need to really identify and fill in those gaps as well. And then the other sort of opportunities relate to, okay, if we understand what well-being is, if we define it, if we measure it like this, how can we improve it? So again, this is not exhaustive. There's lots. We've just added a few onto this slide. Some are very specific. Some are, obviously quite big in terms of system-wide, and require sort of system, leadership and system change. But these are around our sort of collective role. So everyone on the call, all of our roles in sort of health improvement and promotion, and not just things that we can do individually, but people on this call or where we work, also things that we can influence as well across the wider determinants. So these are things that are really driving those measures of subjective well-being. So things around inclusive growth, employment, as is mentioned in the chat, not just employment numbers, but satisfaction with employment as well, and job quality and meaning and purpose. There are also some really practical things that we need to do, like the 5 ways to well-being is a really good resource that we need to use more. Obviously, sort of the importance of physical activity with regard to not just individual well-being, but of the whole population. And then some of those city-wide measures around infrastructure planning, the built environment and placemaking as well, and really ensuring that we have a health in all policies approach across everything that we do, but then we also have almost like a well-being in all policies approach across all that we do, and really reminding ourselves on sort of why we're here in some instances in terms of trying to improve people's quality of life and well-being as well. So these are just a snapshot. There's lots more. If people have like other opportunities or things that they think are coming out of this report, please do let us know. These will be refined and built on as we go through the research and write the report, but just to give people an example. So, we got a word cloud. That was good. There is, I think this should have been question 2. So, oh, wow. Okay, people have already done it. Brilliant. So yeah, if you haven't been able to answer this already, please do sort of go on and have a look. So we really wanted to think about, okay, what, we've talked a lot about measurement, and these are the things that we think influence well-being. How can we then start to improve not just individual well-being, not just community-wide well-being, but then across the whole city of Birmingham as well? So yeah, just a few words that we just wanted to sort of bring out from people. So it looks like a lot of people have actually been able to do that, which is brilliant. So I think I'll give people maybe sort of 30 seconds. There's also lots of really good stuff in the chat as well, that we can sort of come to. And maybe actually, Alex, I can't actually see the chat now. Might be worth sort of just pulling out a couple of questions or a couple of comments from people that we can touch on sort of after the presentation is finished, possibly. Yeah, I think that's probably enough. Some really good stuff in there. I mean, stuff we wouldn't necessarily any of us disagree with. So Alex is going to sort of finish off with another aspect of this report, which is really exciting. And then I think we'll have some time for some questions, hopefully. Thank you.
Yes. This hopefully will function sort of as the dessert to our presentation. So just for something sort of completely different as well, just to ensure that sometimes our annual reports kind of delve into quite specific topics and there's kind of a lot of in-depth conversation. But and that can also focus a lot, as we've talked about today, on kind of measuring and data and granularity. So to ensure that we kind of balance that, I think within the report, there's something that we've done for the past few years is partner with students at Birmingham City University, specifically those who are on the kind of illustration course, to create designs that then go into each of these reports, specifically the front cover and the chapter covers. And what that allows is sort of twofold. So one, for those students themselves, they have experience at a look on a live project element. So what happens is that there is a competition, designs are submitted, the winning ones are chosen by the Director of Public Health, and then they are with kind of some amendments made in terms of fitting them into our kind of presentation style. They are then added to each of the annual reports. And the other element that is it gives a creative interpretation of the report's topics. So as you can see there, I believe going kind of top left along, you've got the cover for social well-being, then civic, then economic, and then environmental. You can see those are the winning designs, I should say. So you can see using the brief and the kind of the topics and the measures that we've talked about in this presentation, you can then see how these have been interpreted and then are obviously kind of displayed as one design. I think it's interesting just to be able to kind of understand how people can visually conceptualize what we've then been discussing, which ultimately can kind of vary into some of the very detailed stuff. So we just wanted to add that as long to kind of raise awareness about it, and also just to sort of hope that those would appreciate that there is kind of a different angles displayed within this report. But that's everything that we were going to cover in terms of the content of this year's annual report. So we've got about 10 minutes, I think. So thank you very much for being able to listen, but we are able to take any questions. I know there was some in the chat. If anyone's asked a question in the chat, but also feel free to kind of ask it anyway, please do so, and we may be able to answer it. Or if anyone has any other suggestions, there are lots of very good suggestions in the chat as well. So just thank you for everyone who has been able to contribute.
Should we end the recording as well?
Yes.
Just from a questions perspective, if people then